thinking in pursuit of a healthier world. Thank you for joining us for today's event. Thank you too to the many who make these conversations happen. In particular, a thank you to the Dean's Office and the marketing and communications teams, without whose efforts these conversations would not take place. In 2020, about 580,000 people experienced homelessness in the United States. People experiencing homelessness include individuals and families, women, men, and non-binary people, veterans, and members of the LGBTQ community, among many others. They are our neighbors, our friends, our family. The drivers of homelessness are complex. They include addiction and mental health problems, domestic violence, lack of income, housing insecurity. They include a range of issues, all of which intersect with public policy and social attitudes, including the challenge of stigma. Our engagement with homelessness should reflect this complexity as we work to shape approaches that support the health of populations experiencing homelessness and the communities of which they are part. I am very much looking forward to learning from today's speakers as we think collectively about the challenge of homelessness. I'm very pleased to welcome today's moderator, Marisol Bello. Marisol is Executive Director of the Housing Narrative Lab, a national communications and narrative research hub that lifts up the stories of people facing homelessness and housing insecurity and the systems that keep them from finding and keeping a home. She has spent a career championing the stories and voices of people with lived experience, so they lead to creating solutions that help every family thrive. Marisol, thank you for joining us. Over to you.
Super. Thank you so much, Dean, for that introduction. We're so excited to be here today. And thank you, everyone, for joining us. It is such a pleasure for me to be moderating today's discussion. It comes at such a critical time for our communities across the country. Folks are facing so many challenges. Rents are soaring, jobs are not paying enough to keep up, and we have a shortage of housing for people in terms of housing that people can afford. And so more people are being forced into homelessness. And so today's conversation is so critical because we can solve homelessness with the kinds of choices that we make as a government and as communities. So I'm excited to hear so much from today's speakers. I would love to introduce them all to you now. First, we will be hearing from Roseanne Haggerty. Ms. Haggerty is the President and Chief Executive Officer of Community Solutions. She's an internationally recognized leader in developing innovative strategies to end homelessness and strengthen communities. Ms. Haggerty is a MacArthur Foundation Fellow, an Ashoka Senior Fellow, a Hunt Alternative Fund Prime Mover, and the recipient of honors including the Jane Jacobs Medal for New Ideas in Activism from the Rockefeller Foundation, Social Entrepreneur of the Year from the Schwab Foundation, Cooper Hewitt Smithsonian Design Museum's National Design Award, and Independent Sector's John W. Gardner Leadership Award. Then we will turn to Anna Leva. Anna Leva, my friend, it's good to see you. Anne is the CEO of the National Alliance to End Homelessness, a public education advocacy and capacity building organization dedicated to ending homelessness in the United States. A career veteran of homelessness and housing policy, she's recognized as one of the foremost experts on homelessness in the nation. Anne previously worked as Vice President for Housing Policy at the Center on Budget and Policy Priorities and as a Senior Policy Advisor at the Corporation for Supportive Housing. And her distinguished career is also marked by a decade of federal service as at the U.S. Department of Housing and Urban Development, HUD. And then we will close our presentation with also my good friend, Donald Whitehead Jr. Donald is one of the country's leading experts on homelessness. Donald serves as the Executive Director for the National Coalition for the Homeless and is also one of the co-founders for Racial Equity Partners. Donald's career includes 28 years of service that have spanned every facet of homelessness service, from outreach to Executive Director. He has served on organizational boards, including 2 terms as President of the Board for the Directors for the National Coalition for the Homeless, two terms on the Board of Directors for Faces and Voices of Recovery, and 2 on the Georgetown Center for Cultural Competency. Now, once all of our speakers finish their presentations, and each will be joining us for a 8 to 10 minute presentation, then we'll begin our panel discussion. I would like to ask our audience to please submit your questions through the Q&A feature on Zoom. And I'll also ask our panelists to wait until our discussion to answer those questions. So Roseanne, over to you.
Thank you so much, Marisol. I'm thrilled to be here with such a wonderful group of folks dedicated to the issue of homelessness who've done such remarkable work in their lives and work. And so I also think it's significant and so appreciated to have a chance to discuss this issue in the context of the School of Public Health and really reinforce, I think, something that has often been missing, an appreciation that homelessness is a public health issue, squarely a public health issue, not just because homelessness compromises the lives and the health of people who experience it. I've read everything in studies showing a 17-year life expectancy gap to one that is much more significant given other vulnerabilities. And also, we just all know that every other health condition is compromised by unsafe, unstable, uncertain housing conditions. But the other reason that it's an important frame to be using in the work of understanding and approaching homelessness is that we've come to see that the public health mindset, the tools of public health, are so powerful and significant and necessary, I'd even posit, in helping communities get to a lasting end to homelessness. What we found in the work that I'll be describing that Community Solutions is undertaking with communities throughout the country, we're finding that the basic approach that public health brings to complex problems of collaboration, data-driven decision-making, science base for the interventions that are tried and tested, and a steady and ultimate commitment to moving toward prevention, that these are the practices, these are the kinds of ways in which communities are organizing their activities that are actually generating results and very much learn from public health. And this lens we find is so essential in the kind of progress that's possible and necessary. And so let me just begin with a bit of an overview of the work that our organization is doing. We are leading a movement called Built for Zero, which now involves 105 COCs, continuums of care, entities throughout the country, and entities of based in rural, urban, large city, bordering on tribal areas. So COCs cover the country, and we're working with about a quarter of these entities, which tend to follow county boundaries. And what we're working toward in each of these places, all of which have joined this movement voluntarily, is to get to an end state that we've defined collectively as functional zero, which is a measure of homelessness being rare overall and brief and non-recurring when it occurs. And the measure is almost a net zero homelessness. Communities get to the place where they can consistently stay ahead of new inflow into homelessness. And as you'll see, I hope, as I walk you through some of the features of this approach and the results that we're seeing, very much rooted in kind of a public health way of thinking. And in fact, our work has been deeply informed by some of the great global health victories, beginning with the smallpox eradication campaign and how you organize community-led efforts to get to a comprehensive end state. So I'll ask maybe for the first slide to be advanced. As I mentioned, we're working with 105 communities, and collectively, these communities have housed more than 156,000 people since that we launched this effort in 2015. But what I'd like to call your attention to is the kind of the riveting fact that 14 of these communities have now reached that functional zero end state for one or more populations, usually veteran homelessness or chronic homelessness. And the beginning of this shift is really coming to understand homelessness as a different kind of problem than the one I think we early on imagined was emerging in the late 70s and early 80s. And it is squarely not a problem of vulnerable individuals. It's a problem of broken systems that fail vulnerable individuals. And so that's why it's important to take this much more uniform approach. And what we find, and what you see reflected so significantly in this slide, is that 64 communities now have the ability to know by name in real time at a population level all of those who are experiencing one or more forms of homelessness, again, veteran, chronic, or all single adult homelessness. And we're moving those communities toward knowing everyone experiencing homelessness by name in real time, because we find that that kind of information is pivotal to having the right information to improve a system, to know what's working, and to constantly change things up to get to that functional zero end state. So we'll move on and I'll tell you how this is actually unfolding in communities. If we can go to the next slide. I think this reframing of homelessness as a systems problem that needs good information to be able to track and help communities handle and manage down to functional zero, a dynamic problem. Well, it's needed dynamic data. Just as I think the whole world has come to understand the role of data in managing a public health crisis through the whole experience of COVID, and looking at rates and how they're changing, and how changing rates dictate different policies and behaviors. Well, that's what we're finding really can help a community turn the corner on homelessness. The communities who are participating in Built for Zero work on getting the data that they're working with to this level of sharpness, so they know in real time, to at least current to a month, who exactly is experiencing homelessness, how, and to be able to pick apart that number in terms of understanding who's new into homelessness, how quickly their system is moving people out of homelessness, who's returning to homelessness, because this data reveals a different sets of problems that community teams need to work on in different, more rapid ways to make sure that all of their efforts across the community are adding up to fewer people experiencing homelessness. And so this new way of really interpreting homelessness through this active data is, again, taken from public health, but really is kind of the revolutionary step. Let's go to the next slide, and I can tell you a bit more about how this plays out, because it's also important to have this kind of data to move toward a racially equitable system. It is sadly no surprise that systemic racism is reflected so deeply in homelessness, that Black and Native Americans disproportionately experience homelessness. But to get to a place where our systems, and even the system of getting folks out of homelessness or to be identified as needing assistance with housing, we find that at every step, it's important to have accurate data so we can see where those racial disparities are and begin to close them. And that it's also important to incorporate not just quantitative measures in this building an effective public health to homelessness, but to bring in qualitative factors. And in this case, this framework for a racially equitable system that we've developed and work with our communities to implement, it was crafted by Black, Native American, and other persons of color experiencing homelessness, who contributed along with community leaders and experts in the field of racial equity work to create this vision that's measurable and quantitatively and qualitatively as we do the work of getting to functional zero homelessness. And so let's go to the next slide. And I'll just end on what we are learning across these communities are really the elements that lead to steady reductions in homelessness. There are 5 things, beginning with a shared measurable aim. In some ways, this seems almost too obvious to state, but as we think about it, so many communities, there are so many well-intentioned, important efforts going on to assist people, and they don't sync up. So many policies designed to create resources or to kind of regulate or direct activity that don't match, that in fact create enormous friction in the system. And so the first thing that our team does in working with Built for Zero communities is to help facilitate the group of key actors to a shared aim of everyone's working toward functional zero homelessness, and is putting that population level view ahead of the individual programs that they are responsible for. Second, it's important that this group across a community is working as a team using the same information to understand how the problem is manifesting itself that day, that week, that month, and what the behaviors need to be to respond to it effectively. So helping the group operate as a nimble, integrated team and to begin to populate a database that is accurate, comprehensive, current, and shared are the critical foundational activities. And then on top of that, the role of housing is, of course, essential, but it also is important to know what type of housing a community needs. Where are the barriers to using vouchers, or is it a different kind of supply and access problem? And we find that communities, when they have this full, true, dynamic picture of the issue, are in a much better place to shape housing policies to be responsive, rapid, and well matched to the actual problem that the community is facing at that time in reducing homelessness. And then lastly, we are seeing the benefit of having all of these communities operate within a peer network where they can be learning from each other what ideas have promise, what innovations have really driven solutions to common problems, and to not be starting from scratch, and to have a community of innovators with which to work. And so I'll end there and look forward to being in dialogue with the other panelists later. And again, just my appreciation for the opportunity to have a public health conversation on homelessness.
Roseanne, thank you so much for that. That was so wonderful in terms of setting the stage for our discussion today. So appreciative. Now we will turn it over to Anne to join us, and I will turn it over to you, Anne. Thank you.
Here we go. Hi, good afternoon, everybody. It's just a pleasure to be here. Thank you so much, Dean Galea and Marisol, and everybody who put this together. And it is always a pleasure and honor to be sitting on a panel with my esteemed colleagues, Donald and Roseanne. So it's nice to see all of you. Roseanne really brought us some focus on processes that work in communities. And I have been, I've worked alongside community solutions in a number of different communities and have seen the power of being able to use data and being able to reduce the number of people who are experiencing homelessness to that functional zero. I saw a big wow in the chat when she gave that data about how many communities have reached functional zero for a particular population or subpopulation. But I'm going to actually zoom back out for just a moment and let you know a little bit about my own organization and what we're tracking in terms of the data overall and the public health, particularly the public health implications. And I apologize, folks, I'm a little bit under the weather today, so I'm not my normal bright-eyed and bushy-tailed self today, so I'll do my best to work through my presentation. So I'll start with, there we go, the National Alliance and who we are. We're a nonprofit, nonpartisan, national organization who has a really simple mission. Our mission is to prevent and end homelessness in the United States. And we do that in a variety of ways. We have three major pillars that make up our organization. And our first is our policy and programs pillar, or our component, that component of our organization. We educate federal policymakers. We work with members of Congress and the administration, whichever administration is in play at any given moment. And then we also work on grassroots advocacy. So we have a team of folks who works in the field to mobilize advocates all around the country, especially people with lived expertise, to move forward a particular agenda, usually having to do with really high-level policies that are enacted by Congress through the law, or around appropriations, that is, how much money is being spent on the programs that are important to ending homelessness. We also, if you go all the way over to the right, we also have a Homelessness Research Institute. That institute does partners with our research partners all over the country. I'm going to give you two examples a little bit later on in this presentation so you can see the kind of work that we're doing. We do some original evaluation and analysis ourselves as well, and then we post that all on our website, and we use it to, again, sort of loop back to the policy and programs and inform our policymakers nationally at the state and local level. And then we also have what we call a capacity building team. And that team actually works alongside communities to implement those practices that we've identified as the best practices in the field, so that communities really have somebody to walk along with them and really work through problem solve challenges that they have or are experiencing in their community. So like I said, I'm going to zoom out for a moment so you can take a look at what we're talking about when we talk about people who are experiencing homelessness. This data is from 2020. The reason that we're using 2020 data, I have some 2022 data in here as well, is that during the pandemic, the data collection that usually happens on an annual or every other year basis was not quite as complete, and we don't consider it to be robust enough to be using to look at these trends. And I also saw a question in the chat about who is collecting this information and how. And I'll just note that HUD requires every community who receives funding from them to have what they call a homeless management information system. Those systems are big databases that track the number of people and also a number of characteristics of people who are touching our homelessness assistance systems. But as Roseanne said, sometimes there's some challenges with that data collection at the local level. And we also use another sort of complementary set of data called the point in time count, which is what you're seeing in front of you right now. That is a count that's done in January of every year by communities, and it includes unsheltered people that maybe are not touching the system. There's lots of challenges with this data, but at the end of the day, right now, this is the most comprehensive data set we have at the national level, especially around unsheltered homelessness. So what you can see here is we collect information about the total number of people who are experiencing homelessness. Again, this is point in time count data from 2020. The number of individuals and people and families, as well as other populations and subpopulations. If you look at the pie charts at the bottom here, what it tells you is the proportion of those populations and subpopulations of people who are experiencing sheltered versus unsheltered homelessness. And in 2020, we saw two things happen that we've seen for the first time since we started collecting this data. Under the number of individuals there, you can see the number of individuals experiencing unsheltered homelessness exceeded the number of individuals being living in shelters. And that's the first time that sort of line has been crossed for the total population of individuals experiencing homelessness. And then we also saw for people and families, the number of unsheltered people and families go up from the year prior for the first time since we started collecting that data again in 2020. And then if you look at the information in slightly different ways, you can see that there's a few things here that I want to point to. The red line is unsheltered homelessness. And you can see that has been steadily increasing since about 2015. And I'm going to talk about the implications of that in just a moment. But there are a lot of policy implications. There are public health implications about how people use different systems, and the mortality rate and age of people who are experiencing unsheltered homelessness. You can see that families has been steadily decreasing over time. And you can also see that veterans has been decreasing for the most part over time. And that's in part due to the process and the data collection that has been put in place by organizations like Community Solutions in communities. And it's also due in part by the fact that the resources that are available for veterans who are experiencing homelessness are closest to the scale that we need. That is, there's quite a bit of resources through the HUD VASH program, which pairs together resources from the VA, behavioral health, healthcare, and other types of resources from the VA with housing vouchers that provide affordable housing for veterans who are experiencing homelessness from HUD. So there's a number of things to learn from what we've done on veteran homelessness, but I thought that this was sort of helpful for folks who might not be aware of what the data looks like when you break it down. And then also, as Roseanne mentioned, it's really important to talk about who is in those populations and subpopulations of people. And we know that minority groups or marginalized populations are overrepresented in the number of people who are experiencing homelessness across the board. This really shows race and ethnicity, but the overrepresentation carries over into LGBTQ people, people with disabilities and others. And all of that has implications on the policies and funding that we need to move forward. And then looking at it in a slightly different way in terms of the rate of people experiencing homelessness per 10,000, you can see the Pacific Islanders by far have a higher rate than any of these other groups. Black people, Native American people in particular are overrepresented, as I mentioned, and have higher rates of homelessness. And that makes, as Roseanne mentioned, it actually is the result of systemic racism throughout a number of our systems, including our behavioral health and public health systems, who has access to healthcare resources in communities and historical disinvestment in communities, including redline communities in our nation's history. So as we think about, if we go back to the three pillars of how the National Alliance works, you will note that we have, again, the policy group, the group who does research, and the group who works in community within the Alliance's structure. And what we are always looking for is information about changing trends. And I'm just going to give you two examples of trends that we are seeing right now that are influencing what our research agenda looks like, what our policy priorities are when we talk to people on the Hill, and how we're addressing homelessness in communities. And the first is, this is a report. I'll put a link in the chat so folks can take a look at this report. It just came out a few weeks ago from the state of Minnesota. And it is not inconsistent with other research on the mortality of people who are experiencing homelessness. But the numbers that Minnesota recently published, I think, were pretty shocking to most of us in the field. So you can see in Minnesota, the rate of death is 3 times higher among people who experience homelessness than in the general population of people living in Minnesota. It impacts young people at very high rates, and they're having the same rate of death as older people experiencing who are housed in the general population. You can see that American Indian people experiencing homelessness have 1.5 times higher rates of death than other people who are experiencing homelessness in Minnesota. And death from substance use are 10 times higher among people who are experiencing homelessness in the general population in Minnesota. So this is pretty significant information. It's this kind of information and data, again, that really informs our work in other areas, and that we will be bringing to our national and federal partners as we think about what the right policies are and how we invest our national resources into this issue. And then the other item that I will just flag for everybody today, that is something that the Alliance is really focused on right now. Right now, we have staff specifically working on this particular issue, and that is an emerging crisis of older adults experiencing homelessness. And this data comes from the University of Pennsylvania. I will put the link in the chat in just a moment. But you can see that over time, between 1990 and 2010, single adult males who are shelter users in the United States are getting increasingly older over time. This has a lot of implications for our healthcare system. It has a lot of implications for how people, the kinds of services that people need, the kind of support that people need, and the kind of housing that people need in order to end their homelessness, as Roseanne described. And then lastly, I really want to wrap up with this set of priorities. And in 2021, we held a number of focus groups with people experiencing homelessness all over the country. And it's part of a project that Donald and I work on together. It's called the Framework for an Equitable COVID-19 Homelessness Response. And we asked people what they wanted us to focus on, people who were currently experiencing homelessness or who had experienced homelessness in the recent past. And these 4 items came out sort of loud and clear as priorities from those focus groups. The first is it should not be a surprise to anybody, but adequate affordable housing options are really needed. Folks are having a hard time finding affordable housing. They're having a hard time keeping affordable housing if they're already in it and it's not subsidized. So really increasing the amount of affordable housing options and the supports that go along with those, and targeting those to those who are most impacted by structural inequities. The second item that we heard a lot about was dignity-based services, trauma-informed, person-centered services, co-designed by the communities who are most impacted by homelessness, and really figuring out how to support those kinds of resources and services in a post-COVID environment. The third one gets at something that Roseanne also touched on just briefly, and that is what happened to people who are experiencing homelessness during the pandemic. And what we saw was that emergency shelter options during that period of time, especially early in the pandemic, were not just inadequate, they were dangerous. And we actually had shelters that were either closing or really changing their physical structure in order to allow for social distancing and those kinds of things, and to be in alignment with the CDC's requirements. But folks were really clear with us that not only were those congregate emergency shelter options inadequate and harmful during a pandemic, but they were inadequate and harmful in normal circumstances as well. And that we really need to rethink how we provide emergency or crisis response services writ large as we move forward. And I know Donald is going to touch on this last one, so I won't spend a lot of time here, but the fourth thing that came through loud and clear was the trauma that's created by criminalizing people for simply existing in a community who are experiencing unsheltered homelessness. So, with that, I'm happy to take questions when we get there. I'll put some of my links in the chat. And Marisol, back to you.
Thank you so much, Anne. Really appreciate it. Before I turn it over to our colleague Donald, I see so much activity in the chat. Super excited by it. And just a quick reminder for folks to please add all of your questions in the Q&A. We want to make sure we get to the questions. We don't want to miss anything, and so please add them to the Q&A. And thank you again, Donald. I will turn it over to you.
Thank you so much. Excuse me. Thank you so much, Marisol. And really want to thank Boston University for having me and my esteemed colleagues to talk about an issue that we work very diligently on every day of our lives and are committed to. We thank you so much for having us here. Want to start off by talking about my organization, and that organization is the National Coalition for the Homeless. I won't stay here, but just a couple of things to know. The National Coalition is the oldest organization that works with and on behalf of people experiencing homelessness, meaning that our direction, our policy, all of the work we do on the ground is driven by conversations with people experiencing homelessness, and we do that on a daily basis. In fact, 50% of our board of directors and 90% of our staff are people with lived experience, including myself. And our mission is to end and prevent homelessness while ensuring that the immediate needs of those experiencing homelessness are met and their civil rights are respected and protected. And that is where I want to begin and continue with my comments. It is really important. We do have a campaign ourselves that is looking upstream at some of the underlying structural issues that impact homelessness. It's called the Bringing America Home Now campaign. And we've partnered with over 100 national and state organizations and many local organizations and individuals to really look at those underlying issues that you've heard about, the lack of affordable housing, poverty. We have 6 pillars. The pillars are income, their housing, their civil rights, their education and training, and of course, racial equity, really looking at how we work with the elected officials in this country to address the structural needs of homeless individuals. But today I want to start where Anne ended, because again, we work very closely with the people experiencing homelessness throughout the country to be a platform for their needs, their issues to be in the forefront of our thinking and our work. So over the last 2 decades, probably 4 decades actually, we've seen a shift in kind of how people have received the issue of homelessness and how the community as a whole has embraced it. So what used to be a community of the caring has shifted in many communities across this country. And what we see is a pattern that is a complete detriment to the health of people experiencing homelessness. Anne gave you a report. We work on a committee with the National Healthcare for the Homeless Council. It's a mortality committee where we look at these issues across the country, from Minnesota to California. We look at how many people are dying as a result of homelessness. And one thing that I will share with you is that most of the deaths are preventable deaths. But one of the things that is one of the biggest factors in those deaths is criminalization. And so we wanted to talk to you about some of the health impacts of criminalization, and criminalization comes in a couple of forms. There are encampment raids where people are moved from place to place when they become homeless. Most of them are in encampments that people enter into for protection, for a sense of community, but communities across the country, as they see the numbers growing, as you've heard in the previous presentations, their reaction to that is not one of creative solutions. It's actually criminalization. And sometimes that's ticketing people, putting them in jail, raiding encampments. And also there's a level of forced institutionalization, which we see happening across the country. From a public health perspective, raids exacerbate health problems and create new ones. They create additional barriers to accessing housing and employment. People with criminal histories are much more unlikely to be able to get into housing and employment, which are issues that would solve their homelessness. Unfortunately, tickets and the inability to pay fines escalate. This becomes a snowball effect, and people are sometimes sitting on a bench actually continues to the point where it becomes a felony. It's actually a felony just to be outside in some communities. Tennessee now has laws that says it's a felony to be in a public space camping. So basically, it's a felony to be homeless. The issue of the raids on encampments actually undermines the trust in systems and sever connections to community organizations. It also contributes to drug overdoses. People in those encampments sometimes they lose many things, including the ability to get Narcan. And some of those deaths all of them are preventable. Some of them are even more preventable because of the criminalization that's happening. There are a lot of other impacts. People experiencing homelessness involved in raids lose valuables. They lose identification. They lose their personal items. They lose clothing. Sometimes they lose medical devices. We've seen instances where wheelchairs or CPAP machines or other medical devices have been picked up. And these are human beings. So the thing to remember about this is we're not talking about statistics. We're talking about living, breathing human beings. You saw the characteristics in some of the other presentations. Our population is growing older. It includes women and children. It includes all facets of the population, and criminalization has a completely negative impact on people. It forces people into isolation. Sometimes those results can be deadly. Over the past few years, we've seen people that have committed hate crimes against people experiencing homelessness, including those that result in death. We had a serial killer who was traveling between New York and Washington, D.C., randomly killing people who are isolated and homeless. So people experiencing homelessness, again, sometimes they're in encampments, and we're not endorsing encampments, but they do provide a lot more security than people who are isolated in other places throughout the city. We know, and this research is still under peer review, that people experiencing homelessness have shorter lifespans, but people in encampments have even shorter lifespans than the general homeless population. That particular research is still in peer review, but it took, there was a study of people in encampments looking at their lifespan as compared to other people in the population. We found that people who experienced homelessness who were in these raids actually had shorter lifespans. Again, some of the additional issues are that life-saving medications and medical equipment are destroyed. It increases arrests and assaults of residents, and we know when there are interactions sometimes with the police force, as we know, it can result in things that are far more deadly than whatever perceived offense the person was involved in. It disproportionately impacts people of color and also people with disabilities. The idea of encampment raids also violates the Constitution and is contrary to the Declaration of Independence. All people living in the United States are protected under the Fourth Amendment of the Constitution, from unreasonable search and seizure, and by the Eighth Amendment, which prevents them from excessive fines and cruel and unusual punishment. Seizing property or imposing a fine or arresting someone because they're existing in a public space violates all of these rights. So it's not only bad public policy, it not only endangers the health of individuals, but it violates the Constitution. There was a finding in the Ninth Circuit that in a case called Martin versus Boise, that if a community could not provide adequate shelter, that they should not be raiding encampments. And that finding in the Ninth Circuit has been completely ignored by most communities across this country. And lastly, we were promised in the Declaration of Independence life, liberty, and the pursuit of happiness. It is my contention that the pursuit of happiness cannot be a part of our lives if we are forced to live on the streets of this country. We can do a lot better. This is the fourth instance of homelessness in our history in this country. Every other instance has been concluded by a introduction of resources from the federal government that were substantial enough to dramatically decrease the issue. Unfortunately, we have not seen this during this period of homelessness that really started in the late 70s and early 80s. We've not seen that influx. We thought that we would, because we did actually have some hopes that the Build Back Better plan and its housing production resources would become law in this country. And unfortunately, that didn't happen. But important things to remember, and again, this is coming from the place of people experiencing homelessness. There's some really important things to remember. Housing should be a human right in the United States of America, as it is in every other developed country who signed on to the Universal Declaration of Human Rights. The United States has not signed on to that. Homelessness is solvable. We can end homelessness in this country if we bring the level of resources to the extent of the problem of homelessness in this country. Homelessness is not a choice. I hear so many people talk about the idea that people choose to be homeless. In my 28 years of work, I actually have never encountered someone that has said that. People may say that as a defense mechanism, but people do not choose to be homeless. People are forced into homelessness, and Housing First is a proven response to homelessness. And we hope and we wish that communities will move closer to these evidence-based practices that have proven to be effective. I think Housing First has about a 90% success rate. But in addition to Housing First, we need more housing production, and we have to definitely address the structural issues that are needed to end homelessness, including addressing structural racism, addressing poverty. We see every year the National Low-Income Housing Coalition do a report called Out of Reach. And in that report, what they find is that a 2-bedroom housing apartment, or even a modest 1-bedroom housing apartment, is not affordable in most of the United States. And the 2-bedroom, nowhere in the United States is it affordable. 1-bedroom, only about 10% of the country. The housing wage in the country is over $25, but we have not increased the minimum wage to meet that. We need more mental health resources. We have a system that has never responded to the promise of deinstitutionalization. And until we do that, we'll see more and more people with mental health issues, either in the criminal justice system or on the streets of our country. And finally, we need to address the issue of criminalization. We are embarking on a 50-state initiative to work in communities because the decisions about criminalization are not being made at the federal level. They're being made at the state level. So we're going to go to those state houses and move communities to push for resolutions in their states and local communities that don't involve criminalization. I think for me, that's it. I do have information on how to reach me on the slides, and I will share that with the team. But thank you very much. And didn't want to go to statistics. I wanted to personalize this issue because it is a personal issue. These are people experiencing homelessness, and they're not homeless people. And we need to remember that when you hear about sweeps in a community, these aren't sweeps, they're raids. Because we don't sweep people, we sweep trash and we sweep leaves, but we should not be talking about sweeping people. So thank you very much.
Donald, thank you so much. That was wonderful. And how you ended actually is going to lead me to some questions that I have for you all, but I see that our Q&A is blowing up and I'm really excited by it. Donald, thank you. I'm going to ask all of our speakers now to join us for the discussion part of our event. If you could turn your cameras on and your microphones on, that would be super. Our Q&A, as I mentioned, is really kind of moving, and I want to kick it off with a question of my own for the three of you. I've talked with Donald and Anne about this, and I know, Roseanne, that you all are doing this work as well in terms of narrative shift and narrative change. And I know that that is a part of a lot of the discussions as we think about and talk about solutions. I'd love to ask you all how narrative, advancing narrative, what role is that playing in the work that you all are doing, and why is it important? And I can, maybe just ask Anne to kick us off on that one.
Sure. Thank you for that question. It's really important, and it's something that we in the field talk about with each other quite a bit. I'll start with saying that I think in our field, narrative itself and how we communicate with the public has not been a huge priority for us generally, because in my own career, I've been doing this about 30 years. Addressing homelessness and ending homelessness has always been something that felt like a shared value. It was shared in terms of politics and bipartisanism, and across communities. But as I mentioned in the data that I showed, as unsheltered homelessness has started to increase and our sort of political world has gotten more and more charged around a number of issues, there is, including homelessness, there's been sort of increased pressure on elected officials to Donald's point, like to do something, and that has resulted in criminalization, raids, and really the dehumanization of people who are experiencing homelessness, especially unsheltered homelessness in our communities. And so one of the things that I didn't share when I talked about the work of the Alliance, and I showed those three components of our organization, those three pillars, was that actually communications now cuts across all three of those pieces of work: policy, community level work, and research, because we have to be better. And we're taking a lot of our lead, certainly from you, Marisol. We have to be better in talking about homelessness in a different way, and not just using the data, but really providing communities with the tools that they need to combat harmful rhetoric, things that are resulting in bad policy. And there's a lot of, good work that's being done that's not being put out there in a way that's digestible for folks. So that's something that we're working on. I think it's a work in progress, and I would offer. I'm sure that my two colleagues have more to say on that.
Thank you, Anne. Donald, Roseanne, I'd love to hear from you both how and why narrative is why it matters.
So a couple of things that, one of the things that we always have focused on as an organization is there's all these stereotypes about homelessness, who homeless people are, why they're homeless, all of those things. And it's really important that we put a face on the issue, because the face that people see when they hear the issue of homelessness is a face that is one that's included in the population, but is not the predominant face in the population. There, people come from all walks of life. I've met doctors and lawyers and teachers who are part of the homeless population, but that's not the picture you see. And I think that there was an active effort underway by millionaires, actually, to present the face of homelessness as one of people who are suffering from moral deficiencies versus suffering from all of the structural issues that we've talked about. So again, people are forced into homelessness because of the rise in housing cost. I mean, housing costs rose 8.5% year over year just in the last year. It's been about an 18% rise in the last 10 years. So people don't see those numbers. What they see is all of the myths that have been created by, the negative depictions of people experiencing homelessness. I mean, you could go through the roster of people in Hollywood and see just a number of people that have created all kinds of things in this world that have been homeless. So it's important that we reshape that narrative so that people stop seeing this as an issue where people need to be fixed, that they're morally deficient, and see the issue, it's a societal failure and not an individual failure. And until we start addressing the societal failures, we'll never be able to end homelessness.
Marisol, I think, just building on what Anne and Donald said, so wisely, I think this is, it is the key question. Like, I think we've gotten the story wrong on homelessness all of these years. And just two illustrations about why breaking through the communications kind of fog, I think could be the key to the kind of progress that we know is possible. First of all, I think those of us doing the work have tended over time to stress the need and the urgency and not been as insistent on describing the solutions. A couple of years ago, this really trained us and our team to just talk about homelessness as a solvable problem, just lead with that all the time, because we had Googled, solutions to homelessness, and what was coming up is like, there were very few stories you could find then, like Girl Scouts handing out tents. I mean, it was laughable. And yet, the work that all of our organizations have done have like moved so many people out of homelessness, have reduced homelessness. Anne's quoting, the very steady reductions in family homelessness, the extraordinary progress made on veteran homelessness. We actually know what to do. It's about like the political will and the discipline to do it. And so first, like, we need to tell us a different story about this issue of the solutions being known, and it's about just execution and policies that accelerate the kind of accountable progress that we need, and not inadvertently complicate matters. And the other, and to build on Donald's point, I think the tendency has been to just go right to like questions like, well, what percentage of those experiencing homelessness have a mental health problem? Or, why are people resistant to using shelters, as opposed to really looking at, as has been the powerful, kind of example in public health, like, what is causing vulnerable people to be in this situation?
That's right.
And one of the most telling moments in a talk I gave a few years ago that was a real clue to this was, I showed sort of like a hand-drawn chart of a community we were working with, just mapping out what it took to move a single individual from homelessness into a home. And it looked like a game of chutes and ladders, like all the different people who had to coordinate, all the different rules, the eligibility criteria, the original documents. It's a miracle anybody got housed. That all it took on average, this group of all these very committed staff from different organizations saying, like, this is like a mess. And I showed this slide, and afterwards a bunch of people came up, each with their own stories, never having experienced homelessness, but saying, that's exactly the experience I've had trying to get Medicare for my mother, or that's the kind of experience I've had trying to get my daughter with disabilities the services that the state is obligated to provide for her. This story of how we have complicated access to a basic need being fulfilled, and yet have kind of ended up blaming the people who experience the need when we have this messed up system. I mean, that's a problem we can solve. And I think talking about like what is in our power to solve, and what we can learn from public health about collaboration, data, moving into the space of accountability and learning is part of the narrative shift that we need to engage.
I love that. Thank you all, because I find this such an important piece about, in order for us to move policy, we need to move people. And so this is such a critical piece of so much of the conversation. I'm going to jump into our Q&A, which folks are really engaged here. So our first question, Roseanne, actually, I'm going to keep you going. The first question is really about engaging at the community level to support a goal of functional zero is a wonderful and innovative idea. How does this work at scale?
Well, I mentioned we're working with now 105 communities, and while each community has its own reality and its particular context, what we find are the kinds of tools and the kind of training and above all the mindset is going to be the same wherever you go, and that those are teachable things. And again, for those of you in the public health world, this will seem very familiar, but it's sort of like it's something we've had to learn in the homelessness world, which is you've got to start with the shared aim. You've got to start with measuring progress in the same way. You need to function in terms of not like my program versus your program, or my theory of change versus your theory of change, but like, is at the population level, the situation improving for our community? And then to have the the accurate and a population level and real-time information to tell if what you're doing is working, if the problem is getting worse, if it's getting better, and then just the freedom, and frankly, because again, public health, shows up in emergencies, not just in terms of the maintenance of health, but in an emergency, you just don't stick with your plan if it's not working. You iterate based on what the data is telling you. And so those are the things that actually can be practiced at scale. And so teaching communities to work in a new way is the thing that we've undertaken with Built for Zero. And you don't have to be part of the Built for Zero movement to realize, like, this is a smarter way to get ourselves organized. And so we're just excited to see this way of thinking being adopted in many more places than we actually work with directly.
Can I
Super.
add
Thank
to
you.
that?
Please,
Even though that question wasn't for me, I've had a chance.
all good.
I've
Jump
had
in. It's a discussion, Ann.
to work with the community solutions team, and the first population that we really worked together on, especially when I was at HUD, was with veterans experiencing homelessness. And there were a couple of things that I think are really important there. Once we started making progress, then resources also followed that progress. So it was from a public policy standpoint, we started working in communities alongside community solutions. They were breaking down the chutes and ladders of like how long it took folks to access housing. We were working through those issues. Communities started to have the proof point. And then we also had members of Congress take note. We had mayors and governors take note. We had the administration take note. And it actually became something where, like I said earlier, part of the reason that we have the progress that we have on veterans is because it is the investments are as close to the scale as what we need. They're not exactly what we need, but they're as close to the scale of what we need than any other population that we serve. So once that those things go together in the world of investment and resource allocation.
We can see with veteran homelessness what happens when we do achieve scale. So thank you so much for that. Donald, I'm going to ask you this question. Much of homelessness policy does not appear to be grounded in public health or even a desire to end homelessness. How do you all navigate an abolitionist approach when the environment is rather accepting of the status quo on this issue?
So I think there are a number of ways that we have to address that. One of the themes behind the Bring America Home campaign, and I know that the Alliance has done some work around this also, is to bring in some of the non-traditional partners, the public health community, the communities that work on addiction recovery, bringing all of those players to the table to have a unified approach to ending homelessness. I think it's also getting some of those other federal departments to invest more into the issue. So HHS and the Social Security Administration, I could go across down the line and name all the agencies that need to have a more a stronger influence on the issue of homelessness. Department of Labor, there's not many programs within those departments. So our approach is to try to bring in the groups that have influence in HHS or have influence in the mental health network or have influence with those that actually practice medicine. So to bring in those people to the table where they've never been. We've kind of been an isolated community at times. And so it's similar to what Community Solutions is doing on the community level. We're working to accomplish that on a national level. I want to go back a little bit to the discussion about the idea of changing the narrative as well. I think the other part of changing the narrative is making sure that we frame this as a justice issue.
So key.
And I think the more we push the idea that there's an injustice when people are sleeping on the streets of the richest country in the history of the world, I think it actually has a lot of it definitely weighs really heavily on people's decisions that they're making in communities. And I also think we can't ignore the need to empower people with lived experience. So one of the things that I think we do very well is we actually work with people. I think about this quote, and it may not connect with everybody else as it connects for me, but I think about Harriet Tubman's quote when she said, "I've freed 1,000 slaves, and I would have freed 1,000 more if they knew they were slaves." And so to me, kind of the connection with homelessness is that many homeless people blame themselves, whether they're going through domestic violence or other issues. If we help them understand that it's not their own issues that got them here, it's an issue of injustice. We've housed almost 1,100,000 people experiencing homelessness, but how many more would we be able to house if they knew it was a justice issue and not an issue that they brought upon themselves? So just wanted to share that.
I appreciate that, Donald, because as you were talking, the thing that rose up for me that I always think about is that homelessness is what happens when we don't have housing justice. Right? Homelessness is what happens when we don't have racial justice. So it's so key to be thinking about it as a justice issue. And Roseanne, I didn't know if either of you wanted to add anything else to that question.
I think I'm always so it's hard to go after Donald when he answers that question because his answers are always one fully aligned with my own, but just really thoughtful. So I don't think so.
Well, I have someone asked a question here that I think is also really critical, continuing with this idea of reshaping and thinking about narrative and how we do narrative change. Someone asked, what is the difference between overall homelessness and unsheltered? Right. And
Yeah.
I'm curious who'd like to jump into that one, because I think that, again, it's about the perceptions of who is experiencing homelessness and who is not.
Yeah, I'm happy to start, but I know that my colleagues probably have things to add. So from a technical standpoint, in terms of a definition and the definition of the data that I presented, when we talk about overall homelessness, we are using a definition that's used by the Department of Housing and Urban Development. It's really around eligibility for their programs. And it's people who are living in places not meant for human habitation. So that's the street or cars or RVs, abandoned buildings, those in tents in McPherson Square in Washington, D.C. And then it's also people who are living in temporary places like emergency shelters or transitional housing programs. The data that I presented did not have data on people who are living in doubled up situations and people who are at risk of homelessness. And in part, that's because we were using the definition of how the data is collected through the homeless systems. And that's the data we use to report out. And it's very, very difficult to enumerate the number of people who are in doubled up situations across the country. And I don't think we have a very good or accurate way of doing that at this point. So when we say unsheltered, we're really talking about the portion of that overall population that is living in places not meant for human habitation.
Thank you. And the Coalition for the Homeless in Chicago actually has been working deeply on this issue of being doubled up,
That's right.
Tracking folks that are doubled up. And I know that they've been doing a lot of work in the Midwest around how to do that, because point in time, for example, doesn't really count for that.
Well, I think that the other piece of that puzzle, right, is that if you go back to the slides that Roseanne presented around inflow, people who are in the system, and outflow, you actually have to understand who's coming into the system and how many people are coming into the system. Many systems across the country, what we're seeing is that they're actually housing more people now than they have in most of their recent history, but the inflow is overwhelming their system's capacity to house people. And the cost of housing is creating more inflow, and it's making it harder for people to exit the homeless services system, even if they have a voucher or other type of rental assistance in hand, because the units are just really the unit vacancy, rate is very low. So I think that understanding that inflow and understanding folks who are at risk, even if they're doubled up, is important. And I believe the Center on Budget and Policy Priorities actually recreated the analysis that was done by the folks in Chicago and posted a blog on it. I'm happy to put it in the chat for folks.
Oh, that'd be great. Thank you, Ann. Speaking of sort of specific populations, someone asked, what are some best practices some organizations are using to help house and maintain housing for transitional aged youth 18 to 24? We know that's obviously an area, particularly foster kids, for example. Roseanne, maybe you could kick us off on that question.
Sure. Well, it's always about getting stable housing and the right combination of supports around that individual or family. What we see is it's important, and this builds on the even the doubled up questions. Young people presenting as homelessness often kind of get missed because they are going from couches to temporarily living with one household or another. And so the first practice is a good detection system, and we find that school systems are really important to involve in this, as well as child welfare and the foster care systems and juvenile justice, so that they're young people who are in these institutional settings, that those settings have a responsibility to understand when young people are facing into a situation of housing instability or homelessness. But the models are pretty varied, but what matters and what is consistent in terms of effectiveness is the accountability that's being taken in that community to see that young people are connected to some kind of stable living situation and have whether it's education, employment, health, mental health services, that they are sort of frictionless, that they're available and helping them bridge that period of instability, especially after a separation from an institution.
Thank you so much, Roseanne. I'm always struck because I don't know that the general public understands or can see that population of young people from 18 to 24 is so vulnerable, especially children coming out or young people coming out of foster care, right? And sort of what happens with them.
Can I add something to that?
Yeah, please,
I think it's really important. Roseanne got to how other systems intersect with homelessness. And I just want to put a finer point on that. It's many of our public systems intersect with homelessness. And when we talk about justice and when we talk about prevention, there is a whole set of other systems, including the child welfare system, including hospitals and behavioral health systems, including the criminal legal system, that all are funnels into homelessness. And we have to be able, from a policy perspective, to work with those systems to try and stop homelessness before it actually happens, but it has to be in partnership and it has to be at a large scale.
And I would just add, there are resources in place that have been identified for permanent housing for people leaving the foster care system. There's a specific resource for permanent housing, but with any of these populations, it's really important that people understand that it's not housing only. It's housing and supportive services, particularly for that population, especially if they're leaving foster care. There is usually, and this is not a blanket statement, a need for some independent living skills support. And so it's so important that in the best practice models for those groups, that those resources are available too, that people are getting the supportive services and not just housing only, because when you take a young person, you put them in that environment and you expect them to be adults, it's very, very challenging. So those additional, and for every population, a different degree. People in permanent supportive housing need intensive support. but almost everybody that has this experience needs some level of support. So it's not just housing. And that's why we mentioned those other agencies that need to be a part of the solution. Those other supports like case management and financial literacy and all those things are really, really important if people are to become their full selves after homelessness.
And it's so important that we need to keep talking about housing as so intersectional, as the foundation for anyone to thrive, right? You need a safe, stable place to call home. To be healthy, you need a safe, stable place to call home. To go to school, you need a safe, stable place to call home, right? I mean, it is so intersectional, and that's so much of the story that we have to tell about why everyone needs a home, right? And it's interesting. Somebody asked here this really great question about the role that a mental health department has effectively played in combating homelessness in a city. And the example was more of a systemic or advocacy role, or managing direct service providers, providing referrals to community health providers, et cetera. This is sort of like another piece of that intersection and how mental health and homelessness can come together. Who would like to maybe add to that? Or add to
I can
that
start.
question? Yeah, please.
Definitely, the mental health services are critical, and there has to be a connection to those services with the homeless provider service community. The challenge is that we've never, and I spoke to this just a little bit, deinstitutionalization the idea started in the 50s and 60s and actually got fully introduced in the 80s. We've never created the resources necessary to address mental illness and behavioral health issues in this country. So we were promised community-based facilities, smaller facilities, because for good reason, those large facilities that house people and sprayed them with water hoses were horrible. And we needed to create something different. We needed to stop warehousing people. We've never received those resources because of another issue that affects homelessness. People didn't want those communities, those facilities in their community. Not in my backyard, or NIMBYism is a big issue that connects to both of these populations. We have a critical need for more behavioral health services. There's waiting lists in most communities. There's a lot of good work being done through outreach and through healthcare for the homeless and federally qualified health centers doing great work when it comes to behavioral health. It's simply not enough. The biggest mental health facilities in this country are county jails. Actually, the Los Angeles County Jail is the biggest, and only 1 out of 5 people in jail with mental health issues actually are getting services to treat their mental health issues. And so, again, we need those other federal agencies to respond and be a part of the solution to homelessness. We have to meet that promise of those smaller facilities or increase the number of facilities we have for people with mental health issues. The homeless service sector has become a mental health sector in this country. A lot of people that could benefit from mental health services are in shelters without adequate resources.
And there's a note in the chat that I think is really important. When we were talking about narrative, I think that narrative of personal failures and blaming the person who's experiencing homelessness often says, they're using substances, they have, severe mental illness. And a lot of folks actually, those things occur after they become homeless. They're a result of experiencing unsheltered homelessness and trauma. They're not the factor that created homelessness in their lives. That's a systemic factor. So I think it's also important. I just noted it in the chat that somebody said that if you didn't have mental health problems before you were homeless, you certainly have them after. And I think that that also is part of this narrative work that we have to do, is to make people understand what trauma and how traumatic homelessness is.
Absolutely. Really important.
Roseanne, did you
all our
look like you
comments-
wanted to jump in?
Yeah, I think all of our comments point to, this reality that, there is such a need for collective responsibility for solving this problem. And we often, see that it should be like a measure of the performance of a foster care system, of a healthcare system, of a mental health system, of a correction system, like that no one they interact with ever becomes homeless. Like the whole field of homelessness shouldn't exist. It's really the expression of the failures of these other, systems that are encountering people at their most vulnerable moments to like take responsibility for all of the aspects of the consequences of those encounters.
Yes. Yes, all of it. Roseanne, as I was, because I was thinking of solutions as you were saying that, I'm thinking of solutions, and I know that in housing and homelessness, we talk about the solution ultimately being housing. People need a place to live, right? And I also am looking at a question that someone asked about shelters, and Donald, you kind of talked a little bit about shelters, and I'm going to just kind of bring it back to this question around the ways that shelters are damaging to those experiencing homelessness. Someone asked that, could you delineate some of the ways that shelters are damaging to those experiencing homelessness and what was verbalized? I'm not sure about the last piece of it, but I'd love to just kind of talk about shelters for a minute, because we do as a field talk about housing being the ultimate solution, but there's a kind of middle point and a transitional point. So maybe Roseanne, you could jump into that one first for us, because you are working with so many of the continuum of cares.
I will say, Marisol, that housing, absolutely, no one has a life of any stability or without feeling like they have a secure place to be. That's just so fundamental. But let me say, in addition to housing, what we are seeing, and this kind of just ties back to the context of our conversation on public health. Public health actually has, as a field, developed its practice around, and what it represents is this: how you take collective responsibility for population health. And so what's so compelling, and I think the bringing together of like, how do we have adequate housing options for all of us, and how do we see that they are matched to people, especially vulnerable people, when assistance is needed to provide the right supports for that process and for stability. We need the housing, and we need the operating system, the behaviors represented in public health, a commitment to have the housing and a commitment to make it simple and accountable, that people are linked to it. And so I just see the more the housing and homelessness and public health communities can join forces, that's what's going to bring us closer to our collective aspirations for an end to homelessness, and everyone in our country having a chance to lead a life of dignity, purpose, and greater health.
Appreciate that. Thank you, Roseanne. Donald, and I didn't know if you wanted to add anything else
Sure.
on that sort of shelter piece.
Well, so let me say this with a great deal of care, because I think we do have a shelter problem. Not only do we not have enough shelter, we need to hold shelters more accountable. And the problem is there's no one who can do that, because HUD has funding for many shelters, but there's many other shelters that are funded outside of HUD. And so there's not an authority that really creates shelter standards. There's a lot of wonderful people that have emergency shelters, that do wonderful things, that have people in those shelters really doing what it takes to move people along. But then there are other places, one that you have to qualify basically to get in a shelter. We need low barrier shelters. You show up at the shelter, you get a bed, and then we try to work on getting you out there with housing first as how we operate that shelter. But a lot of shelters, again, people have to be sober. They have to have settled their mental health issues before they get to the shelter. And, if those things were in place, they probably wouldn't be in the homeless situation in the first place. So we need shelters that have case management, that they have a resource that provides housing for people. But too many shelters don't meet that standard. I remember in Cincinnati, we had something called minimum standards. If you ran a shelter in the city, it had to meet some minimum standards. I think we need to adopt that nationally.
Super. Donald, thank you so much. Wow, the questions were fast and furious, and we didn't even get to all of them. But I see the dean on here, so I know it is time for us to wrap up what has been a really interesting conversation and just coming at a very critical time for all of our communities. And you can see that by all of the questions that folks had, and the chat just really just going off and blowing up. And so thank you everyone for joining us. This was so wonderful today. And thank you, Donald, Anne, and Roseanne. It was wonderful to have you. Dean Galea, I will turn it over to you.
Well, thank you, Marisol, and thank you, if I may, Roseanne, Donald, and Anne. That was a really tremendous session. I was making notes as you were speaking, and one of you said, the goal really is to make sure that everybody can live with dignity and health, and I couldn't agree more. And I really so much enjoyed how you all made it clear that homelessness and insecure housing is not a problem in isolation. It is part of the larger structure of the conditions that we create to create a better world and a healthier world. Thank you all for teaching us today. Thank you to the audience for a really outstanding and engaged audience. But in particular, I want to say thank you to you all for the work that you do every day. And thank you to everybody in the audience who does this work every day. Thank you. We are very grateful that you spent the time with us and for engaging in this conversation.